Here. Okay,
Yeah.
excellent. Jeff, welcome to the program today. We're excited. A lot of people, I know there's a lot of people on here that has incredible stories. But before we start, let me just say this. You can have a lot of good stories in your head, but if it don't make it to your mouth, nobody will ever hear it. So it is so important that there are a lot of new people on here today that's really kind of making an assessment. Well, let me mute everyone out here so we can make sure that all right, Jeff and Dr. Prasad, you're permitted to unmute. Everyone else, I'm going to ask everyone to have house rules of not unmuting unless you're calling home for your story. As I mentioned, there's a lot of people on here that are new, and these people will never know how good Dr. Prasad's products are unless we bring it to their attention. So today, I am so excited to hear from y'all today. This is, matter of fact, it's one of my favorite Sundays. So Jeff is going to read a disclaimer. He's going to be our person that's actually going to be moderating the call today, Dr. Prasad. I know you're on standby to answer any questions or share any thoughts that you can as to why these products are working so well. So people, if you have not told your people, your friends, your family, people you don't like, you need to call them and let them know that these products are real. So, Jeff, for the next 55 minutes, we are so excited to hear about what these stories are. And of course, with the disclaimer that you're going to bring up. Jeff, take it away.
Thank you so much, Bernard. It's awesome to have you grabbing things. We're zooming along the I-10 on our way to New Orleans. And so we're going to have to do some of this call actually from the road. My sweetheart Helen is moving from the co-pilot seat into the pilot seat as we go. But we've got a commitment with a couple in New Orleans this evening, and we want to get there in time. So yes, we're able to do an incredible Zoom like this with stories to share because of Dr. Prasad's incredible formulations. But let me start right off by getting us taken care of. Again, thank you for welcoming everybody here, Bernard. And I'll tell you what, I know that we could have a lot more people on here. Just based on where we were last week, just exactly 1 week ago right now, we had over 100. So let me go to the disclaimer. I will pull that up, and we'll be underway here. And if I'm not able to spotlight myself, so you're going to have to go ahead and take care of that, Bernard, so that everybody can see the words. But as we go
You are
ahead,
spotlighted.
okay, all right. I'm not. I'm just because I'm speaking on your screen. It's pulled me in front and center, but there is no spotlight. So these statements and comments have not been evaluated by the Food and Drug Administration. This information is for educational purposes only and includes recent advances in research on micronutrients. Engage, the micronutrient company, does not claim that our products diagnose, treat, cure, heal, or prevent any disease or injury. However, Engage's products are designed to address nutritional deficiencies. Nothing here is meant to be a substitute for professional medical treatment or a consultation with your primary healthcare provider. So thank you, everybody, for being part of this. And it's my favorite part of the month, this Sunday, when we can go ahead and really lean into the stories, the experiences of others. In fact, I want to just start right out here with a story. It's a follow-up because exactly 1 week ago today, we were meeting Miss Marka Horn for the very first time. We have been on Zooms with her, but we were meeting her in the parking lot of the Mexican restaurant, and that started a week's worth of work in the Houston, Texas area, down in Brownsville, Texas, along the coast to, gosh, we've been in quite a few different cities. But what I wanted to do is just start right out, kind of prime the pump for the stories that we're going to hear. As we got to know Marka, last Sunday in person. We actually got to spend some time with she and her husband. And I'll tell you what, Bernard and Dr. Prasad, what they shared with us was just nothing more than just utterly amazing. In fact, her husband, Tom, had been on one of the GLP-1 drugs. And you remember last week we were talking a little bit about GLP-1, and he had just come back from his dentist to where he's actually had such bone erosion, such side effects from the Ozempic type drugs, to where his doctor, his dentist, actually, it was described that she left the operating room there after having looked at his teeth and his gums, and particularly his jaw bones where the teeth are held in. She left in tears because of the damage that had been done because of the bone density from the medications that he was on to control his weight. And so when we were talking about GLP-1 and it being actually last week, it was still on the special buy two, get one free. They just thought what a blessing it was to have that coincide from a timing standpoint with his desire to transition from what the medications had done to his body to something that is natural, something that they believe in. After hearing the experiences, in fact, we even did a follow-up call on Monday evening with a smaller team inside Engaged to just talk about the significance of the special, what's going on. And as we begin today, I know we're here to hear about the stories, but part of us being here is to talk about Dr. Prasad's formulations. And I'm telling everybody, we are in a window of opportunity here again right now, because it being close to the holidays and the Black Friday special, instead of it being just Black Friday alone, it's already into play. And that is buy 2 Sleep Boost and get one free, or buy 2 of the men's Tea Boost and get one free, or buy 2 of the ladies formula, buy 2, get one free. And so I know we'll be talking about that before we end today. But I just want to say it's so exciting to see people's lives change, and being able to be there in their home. We stayed in their driveway. This is Marka and Tom. Be able to share some of the patented collagen product and what that can do to help rebuild back the challenge that Tom has had with his teeth, to be able to give them hope that what sent the dentist out of the operating room in tears, Tom knows that he can build back. Mark is excited about the timing, us being there, being able to have some products with us, and then the special to where they could take advantage of the GLP-1 boost like last Tuesday. So I am super excited about these testimonial Sundays. So everyone has a story. And so just with that, I know, Bernard, you've already asked for individuals to come forward and begin sharing their stories. That's what I'm going to do right now in this portion of the call is just say, we have a short, just 50 minutes left. That's 50. We're already 10 minutes into tonight. We are recording this. And many of you go back and look at previous months' testimonies, these evenings of stories, and you share them with individuals that you care about, because if somebody else has gone through that same path, as somebody else has had a similar experience, they just tend to be more believable. And so like Bernard has stated, let's share those stories. Let's get them out for others to experience. And again, it's my pleasure to be here as host and co-moderator. I'm hoping that Bernard can still hang around there in the background, because we do need to be traveling down the road as we have this in order to make it to our appointment later on here in New Orleans. So I'm open it up for everybody. I don't see any hands yet, but if somebody could go ahead and be the first one to lead out with their story, their testimony, something that has made a profound difference and an effect in their lives with using Dr. Prasad's incredible formulations. Oh, Bernard, well, thank you for being the first one, and keep priming this pump. Thank you. Go ahead.
But Jeff, I'm the first one because I just got off the phone actually with someone that in her 70s, her cancer had actually returned. She had had a fourth-stage cancer, and she was not on micro daily at the time. Let me see, let's do this. Okay, she was not on micro daily at the time, but she was going through some hard times, and someone recommended that she try micro daily, and so she's been on micro daily for the last 3 months. But since she's come on micro daily, she had aggressive breast cancer, they said, and the doctors gave her very little hope, and they've been treating her with chemotherapy and radiation treatments. And the person that I was on the phone with just before this call actually told me that in the last 3 months, since the last 3 months, she was feeling so bad. She's driving Uber, she's trying to survive. And long story short, she got on the product. And as of this week, she is doing incredibly well since she's been on the micro daily as well as the probiotic. Because with cancer, that's mainly what's recommended. But she's been on the therapeutic dose. For those of you that don't know what the therapeutic dose is, she's taking 3 doses 3 times a day, along with a dose of probiotic with each one. And it was amazing that she was feeling so bad when she began, but now she's feeling good. And she has yet to go back and see her oncologist, but she's expecting to get a pretty good report. And I recommend it to her since she's doing extremely well. She was mentioning the point that can she go down in her dose after 3 months? And Prasad maybe can make a comment on that. But she's quarter, 4th month. She's feeling great. She hasn't gotten a report yet. Most people will get a tremendous report within 3 months. And do you recommend she go back to going down, maybe gradually subsiding with her dosage? Hello, Jeff. Can y'all hear me out here? Dr. Prasad, can you hear me?
Yeah, I'm here.
Yes, thank you. Thank you. Dr. Prasad, he asked a question about how long you want to do the protocol, the cancer protocol. So I'm going to pull you up here and just to answer a question. I know you say at least 90 days on the cancer protocol.
Yeah, cancer protocol that we have developed, interim one, is for 90 days. Yeah. But most of the people after a month or two, they feel very good about it.
It took me about 2 months to feel better. I felt
Yeah.
energetic
So
because I started at the end of June. And oops.
so you feel good about it after 2 months.
Is there a way we could ask you to start your video? There we go. Yeah, this is fantastic. This is who Bernard was talking about. So go ahead. Samsung?
Oh, this is me. This is Kay. I don't know why I changed my name, but this is Kay, and I had cancer. And when I first came on, I heard about Gretchen's story, which made me want to immediately get the product to start for myself because I was lethargic, very, very weak. And before that, I felt almost kind of hopeless. I wasn't going to get any better, but I started on his product at the end of June. I mean, at the end of May. And by August, I was able to go to the event that they had in Florida. And since then, I've had nothing but energy. But I too did the therapeutic dose, and I had my tumor count and cancer counts tested, and they don't see anything. I don't know if it's going on. Start my video. Is it there?
Yeah, I heard
I,
you.
Oh, okay.
Yeah.
Yes.
I mean, that kind
So
of a story we've heard before, but that's amazing a story that you are telling us.
yeah, I don't know how to work the computer. That's why you can't see me.
But that's okay. I can hear you.
Yes. Yes. So, and then my brother, he talked with Horace because he was very sick, his heart, and also his he has high blood pressure. And when he started it, he did exactly what Horace encouraged him to do, and now he doesn't have high blood pressure. That's been in a relatively short month too. He's not here today, but that's his story that he told me, and he said he's not getting off of it.
Good. That's good.
You know, Dr. Prasad, maybe we could take an opportunity because there are a lot of new people on here. You had made a statement that today was verified actually with the person I was talking to. She had breast cancer, but now the doctors are concerned that maybe it has moved. And so the difference with your product versus the products that people generally take out here or treatments, if your cancer is moving, what makes your products so effective regardless of where it moves in the body?
Yeah, exactly. First, I have to know cancer cell, no matter what stage, no matter what type, whether they are sensitive to treatment or not, makes no difference. As long as they are cancer cell, they require glucose and glutamine, two nutrients for survival and growth. And if you deprive them, if you don't allow them to get into this cancer cell, then they will die. No choice. So what high dose, not low dose antioxidant, low dose antioxidant works in a different way. They protect cell system or organ system against chemo or radiation therapy, against free radical damage. So that will be a counterproductive. But high dose antioxidant work by different mechanism. It blocks the uptake of glucose and glutamine, so cell have no choice than to die. Whether you are giving alone or in combination with radiation chemotherapy, then this will improve their effectiveness and reduce their toxicity that you see in normal cell. And many patients who are using this kind of protocol, some of them, most of them are used in combination with chemo and radiation, but some of them don't. And both get equally result tumor free.
Very good. You know, there's a question, Dr. Prasad, since we're on the cancer. And by the way, regardless of whether you have experience on diabetes, dementia, heart problems, whatever you have an experience of, we would love to hear from it. But since cancer was the first thing came up, I've been asked the question, does all micro dailies work? Now, the exception of gummies, because gummies have such little micro daily in it. But when you think about the methylated, the original, and the you have the original in powder form. They were asking me, do all micro dailies work in the case of cancer? And my answer to it was, well, the EMF have four new ingredients to help us when it comes to radiation and chemotherapy treatment. So maybe you can kind of elaborate on if a person that has cancer and is not experiencing radiation or chemotherapy treatments with the original microdaily, the methylated microdaily. Would this work to help improve their cancer condition?
Yeah. Say if you don't have a cancer, if you are talking about general health, then and the reason is, one difference is that micro daily, say original micro daily and micro daily EMF. The difference is that that was not tested against EMF radiation, which coming out from the cell phone, Wi-Fi, and all these kind, and they're very damaging. And so we modified the original one to accommodate the harmful effect of EMF radiation, which you get from your cell phone and Wi-Fi and computer and so on. And this is impossible to avoid it. And so that's the only difference. But as far as the cancer is concerned, high dose antioxidant would be, I would suspect, would be equally effective if you use the old one. For example, for cancer patient, I generally always recommend a hydroform. And the reason hydroform I recommend it because it gets quickly absorbed, and cancer cell can start getting effect very nicely. And so I use the EMF, but I don't know if there are hydroform of other original microdaily or not. But some people use just the capsule. But I think because if you take a capsule, they have to be dissolved and they dissolve at different rate. But the hydroform is quickly absorbed, and as soon as you go to a cancer cell, they block the uptake of gluto and glutamine, and they have no choice but to die.
Now, how important is it to make sure that when you're taking the micro dailies, regardless of which one, that you drink enough water? How does that affect the effectiveness of micro daily?
What? No, they didn't get it.
A lot of people don't drink a lot of water, but they may take micro daily. So,
Uh-huh.
what is the importance of drinking water when it comes to micro daily products?
It doesn't make difference really. When you take whether you take capsule form, that capsule form that you can't take that many capsule. So if you the content of capsule you dissolve in a yogurt or some kind of a sauce, then this is as good as hydro.
I think it's important. Dr. Prasad brought something out to me that I think everybody on here that's going through a cancer regimen need to know. And usually 3 months, you get a significant improvements. Sometimes you may have to have 4 months. But Dr. Prasad also brought out the point that during that 3 month regimen, that is the cancer regimen, which is taking 3 doses 3 times a day, with each dose, you need to take a probiotic. Now,
Yes,
normally you only take one probiotic a day, but Dr. Prasad said to take one with each dose. Dr. Prasad, this is your opportunity to tell them why that's important.
very important because intestinal dysbiosis, that is means number of harmful bacteria increases, and harmful bacteria, they participate in the initiation and progression of all cancer, not one or two, all cancer. In addition, if you are getting a chemotherapy and radiation therapy, it reduces their effectiveness on tumor cell. And then only thing I want to make sure that everybody understand, if you are a cancer, and don't take collagen peptides. That is a no-no. And the reason is no-no, because generally your immune system sells a tumor cell killing cell to an area where the tumor is growing, so they slow down the growth. But what happens, collagen peptide puts a barrier, so they can't come and do anything, so the cancer will grow faster. So we said no, that's the only exception is.
All right. So before we move on, people that's going through a cancer regimen should make sure they're taking probiotic,
Yes.
micro daily. Is
Yeah.
there any other product that would significantly make a change when it comes to cancer?
And also, when you are taking this kind of regime, don't take any other product, any other supplement.
People, that's very important. I had someone that was not getting the results they were looking for. And then after really sitting down and talking with them, what they did was they went out and bought a different product, a different probiotic. And they took the micro daily, but they were taking a different pro. Your products are meant to take together synergetic
Yes.
and synergenic, and definitely do not mix products, and make sure with micro daily it works better when you have food on your stomach. Is that correct, Dr. Prasad?
Yeah, yeah, definitely.
Okay,
I always say take this thing after breakfast, after lunch, after dinner. Therapeutic dose.
I love it. I love it. Okay, there are some other people on here that may have. I think first of all, before we finish, did everybody get the point of cancer? Hopefully, it's got a little bit more clarity when it comes to the cancer regimen. Now, do anyone have any other experience that maybe dip into another field? Well, the diabetic, whether they're a dementia person, whether a person is going through heart problems. Does anyone have something else that they would like to share with us that we can actually get maybe a little clarity on it? Elizabeth, we welcome you. If you can, turn your video on. And what we're going to do is highlight you if you can, if you're in the position to do it. If not, go ahead and relate your story.
Somebody has it. Elizabeth.
And Elizabeth, you have to unmute.
Okay. Thank you. I want to say hi to Tony Jones, too. He's on here for the first time. Tony.
Hello. How are you doing?
Hi, Tony. Good to hear you. Good to see you.
Uh-huh.
My sister lives in Buffalo, New York. I told this a little bit the last meeting we had. She's been very bad diabetic for a long time. Glucose numbers like 500 and 600. Well, toward the first of the year, she was in a really bad situation, so much so that about 4 months ago, they were putting her on palliative care. I got in touch with her children. We had a conference call, and I encouraged them to see that she got on Dr. Prasad's Core 4. She did that about 4 months ago, maybe not even 4 months ago. Well, I got a phone call the other day from her son who wanted to put me on a 3-way with her. He says the doctor has taken her off of the metformin. He has taken her off of morphine. Her A1C is below 5. She's no longer on palliative care, but she's taking Dr. Prasad's Core 4.
Yes, that's perfect.
Yeah.
Wow, wow, wow. And I could tell, Elizabeth, I see the emotions in your eyes. A lot of times people promise everything and deliver nothing. Now you have Tony on here, and Tony is right now on oxygen. And Tony, how long have you been on our products?
I'm not on the product. I'm just coming. I'm just getting introduced to it.
Okay.
I'm not on it at
Well,
all.
Tony, you're introduced to one of the best regimens in the world now. Dr. Prasad, you see Tony. Tony's on oxygen right now. He's probably on 2 or 4 liters of O2.
4.
Oh, now 4 is kind of high. What it does, and Tony will verify this. Most people that are on oxygen are trying to get off because it dries the nasal. I've been a paramedic for 30 years. That's been a challenge with a lot of people that's been on O2. So, Elizabeth, thank you so much for inviting Tony. Tony, do you mind if we ask Dr. Prasad, in your case, maybe talk a little bit about what you're going through and what would be best for you?
Do you have a diabetes?
Go ahead, Dr. Prasad.
Do you have a diabetes?
No, I do not have diabetes.
Okay.
I have scarring of lung tissue secondary to sarcoidosis, and I have heart CHF, and my kidneys are in stage 3. I was just diagnosed lately with prostate cancer. So the prostate cancer is confined to the prostate, and it has not gone anywhere else. And I'm being treated with hormones for that, female hormones, with the thought of sometime in the future getting the radiation treatment. But my PSA went down. I started, my PSA has always run high, but I started with a PSA, it rose to 105. And they wanted to do another biopsy. By the way, I've had 5 biopsies already in my lifetime because my PSA was always high. Well, this time it was unusually high, and they wanted to do another one, which made the 6th one. This time they found cancer, and they put me on the hormones, and it came down to 15, and now it's down to 5. the PSA using the female hormones. So they're very pleased with that. They think they can cure this cancer and with the approach that they're taking with the hormones, and afterward going with radiation, pinpointing the spots where they want to hit with the radiation. So that's where I'm at with things.
I think it would not be a bad idea for your prostate cancer, whether you get radiation or not. That's the material. And if you start now, for example, the protocol that we have for cancer, therapeutic dose, and by the time you are ready for a chemo radiation, and doctor examines it, there may not be any tumor left. And so it does not interfere with the hormone therapy that you are getting. You continue to do it, but also use the therapeutic course. So suppose in a 4 weeks time or 6 week time, your tumor also disappears. Then next thing is that you take care of your, say, lung sarcoidosis, and then you can go back to core 4 with Heart Boost formula, because they have in Heart Boost that increases the flow of the blood to all your organs, and that's look like you need it. And because you can't deliver if you don't have enough blood supply to all your organs, they can't get enough oxygen. And so I think that's what, if I were in your position, that's what I would do it, but it's up to you to make a decision and tell your oncologist. And if he wants to talk to me, he or she, I will be glad to talk to them about this protocol.
Excellent, excellent. And Tony, because of our time, of course, we can get a lot more deep. Elizabeth, you heard what he said though, so you have an idea what to offer them. Of course, that collagen will not be included as long as you have active
No,
cancer.
until
But
cancer is
Elizabeth knows about
resolved,
that.
is not in at all.
Very good. Dr. Prasad, that was fantastic. So we thank you all for that. We're going to have to keep moving because we have quite a few people that, let's see, next we're going to go to Alfreda Strong. Let me make sure Jeff is
Okay.
back. Okay.
Hi.
Yep. Go ahead.
Hold on. I
Okay.
was trying to get this moved to my computer. But I just wanted to basically I wanted to say thank you to Dr. Prasad and tell you about my progress. When we were in Orlando, I talked to you about my situation with lupus.
Yeah.
And just recently in let me see, I'm trying to just recently in October, they reran the anti-DNA double-stranded tests that they do for lupus. Now, when they first did it in February 20th of 25, my number was 386.
Wow.
Which is really high, right?
Yeah.
And so what that means is that I was really into the disease. Although I will say I wasn't experiencing any sickness. Like they said, I should be really sick, catching everything under the sun. And then they had to test me for cancer because my lymph nodes had swollen. And so I tested negative for cancer. So I accredit all of that to me doing a regular regimen of micro daily, because they were like puzzled. And at that time when the doctors checked me, they checked me from head to toe, and they said that I had no rashes or anything. All my organs were in good shape, but I had this really high number for lupus. And so I did tell the hematologist, and both times, both doctors, the hematologist and the rheumatologist, said, well, your micronutrient level is at a really good level. And so the first hematologist, I said to him, well, I take a patented micronutrient formula. And he immediately dismissed that. He said, oh, it's not that. So I thought, you got to be crazy. There's no way my micronutrient level would be in good standing if I wasn't taking a product that was giving me those micronutrients. When I went to see the rheumatologist, he brought another doctor in, and they were looking very puzzled at me, like they couldn't understand why I wasn't sick, like the first doctor said. And so I said it to him too. I said, well, I take a patented micronutrient formula that I believe has helped me not be as sick like you say I'm supposed to be, and also have cancer. And so interestingly, and I said that deliberately just to see what he was going to say.
Mm-hmm.
So he said, well, what's in that stuff? So he wanted me to immediately get a list of the ingredients. So I called Jonathan and got a picture of the ingredients and send it to him. And he just like looked at me like, wow, this is just, really just micronutrients, And so he told me, he said, make sure you keep taking this. All right. Because he agreed with me that had to be the only thing, especially because of my high number. Right. And so, they wanted me to start with the medication. And for the first 3 months, I wouldn't do it. I just refused to do it. And so then after continued talking with him, I said, well, maybe the microdaily will protect me from the side effects that the they want me to take. Well, they had me on hydroxychloroquine.
Mm-hmm.
And so that was in February of this year. And so October 23rd, almost exactly 8 months, I asked him, I said, well, can you run the test again? And initially he said, well, no, because, he had told me before, he says, you're going to have lupus for the rest of your life. And so I was like, I didn't want to accept that. And then when I talked to you, I felt even more adamant that I don't have to have this for the rest of my life. But anyway, he ran it, even though he said he wasn't going to. And when I saw that test come through on my chart, I was shocked because the number went from 386 down to 59.
Wow.
Yeah. And I was like, is that the same test? So I went and found it, from February. And he says that normal is 30 and below. And so, I just remember you telling me, Alfreda, be consistent. Remember when we were having hors d'oeuvres that night, and I stopped you, and you said, just be consistent with the products, Alfreda. You said it'll go away.
Yeah.
Nothing extravagant. I don't have to jump through a bunch of hoops. Just be consistent.
Yeah.
And it'll go away. So I couldn't wait to let you know what's happening. And so, I have to stay the course.
Yes.
I'm not out of the, totally out of the woods. Unfortunately, the only negative thing really that happened was they convinced me against my better judgment to use prednisone.
Okay.
And so I did that for over 3 months, and now that's messed up my bone density. But I even discovered that is not a permanent state. I can reverse that too.
Sure.
So I know I'm taking extra of the collagen. I'm doing the menopause relief for bone health.
Yes.
And is there anything else?
For bone health, we don't have there as yet. But for
Okay.
bone health also, like I take it and I recommend people, older people, take 1,000 milligram of calcium citrate and 500 milligram of what do you call glycinate. Yeah, not calcium, but magnesium glycinate. Very
Okay,
important.
that I can't take calcium because my parathyroid is not.
Oh,
Oh wait, the parathyroid is not acting right. They want me to remove it, so I think after that I'll be able to get then use calcium. The parathyroid is causing my calcium
yeah,
to be
calcium
high.
and magnesium combination that I
Mm-hmm.
take every day, but
Mm-hmm.
has to be right form, calcium citrate and magnesium glycinate.
Okay. So
So I think when you are ready to do, then you can discuss with me again, then I will tell you. But these
okay.
are very important for bone formation. Otherwise, older people don't take much calcium, and
Right. Mm-hmm.
and this is very important for bone formation. And I mean, eventually everything goes downhill because I'm 92, I'm in 91 in January 8, but
Mm-hmm.
still I'm functional.
Right.
Important thing is to maintain brain function is very important. And if brain function is good, then your body function would be good, except some pain here and there that you have it and I have it.
Mm-hmm.
I mean, you are young, but I'm talking about if you are 91. When
Well,
is
that's what I want to get to.
it? Yeah, you will get to.
And even older. So, I just want to thank you so much, for what you've developed. I'm so thankful that I found this product, that Jonathan introduced me to it.
Yeah,
Because who knows, going back and doing research, on this, because I had mono when I was 16, and they say that it goes all the way back to then,
yep.
and so I'm just thankful for you and Micro Daily.
Wow, Alfreda, that's exciting. Thanks Bernard for stepping in and catching us when we had our cell signal dropped and we lost you there for a little bit. But to come back and hear these incredible testimonies, what was that number again, Alfreda? You went from 300 and something
386
okay.
and to 59, and normal is 30.
Wow. And when was that 59 number given you?
October 23rd. So it was only it was only 8 months. After 8 months.
That's
And
very good.
yeah, the first 3 months I didn't even use what the doctor gave me. So really, the combination was 5 months.
Well, that is awesome. Wow.
Yeah.
Again, stories are what it's all about. I mean, yeah, I can see the comments and in fact, Cheryl Johnson was asking, how much were you taking of the micronutrients? Did you up your dose? Give us a little insight in those 8 months as to what you were taking.
I would say, because I was kind of all over the place. A lot of times I would try to do 6 and 6, of the Micro Daily, and so I don't think you probably need it. After I talked to Dr. Prasad, he said just do 2, 1 and 1, 3 capsules in the morning, 3 in the afternoon. So I kind of kept it to that. Also, I needed to keep it to that because they were telling me my calcium was high. And at one point, they made me stop it. And then, they tested me and my calcium didn't go down low. So I'm like, well, it ain't got nothing to do with the micro daily. So I got back on it, so that
calcium is so tiny, small amount compared to
yeah.
that I recommend for bone formation. So
Yeah, so I got back on it because everything else was so critical for me to have in the
yes,
micro daily that I was like, I'm just gonna chance it because I and that's when I realized something else is going on, and that's when they realized something else has to be going on. So, when you're talking with your doctor, you have to really know what's going on so that you can give them the information so they can get to the root cause and not
yes,
just treat your
yes,
symptoms. And so
yes,
that's how we found out about the parathyroid, because it's like the other part of that is that my body temperature drops because of that. I get down, the lowest I've ever been was 95.9, and then I found out 95.5 is hyperthermia. So I'm like, okay, so and that goes back to parathyroid, so I'm learning a lot, but it's just, getting on these calls, learning information and applying it to myself. And then I have more to discuss with my doctor instead of just taking everything that they're saying as gospel. I'm able to ask better questions, and when I see things going on with me, I know my body better than they do.
yeah, that's for
There
sure.
you go. There you go. And to have access to Dr. Prasad, like you referenced, having met him there in Florida,
Mm-hmm.
and just being able to ask him, what a comfort. So thank you,
Yes.
Alfreda,
Yes.
Alfreda, and thanks for coming on and being part of this this Sunday. So we've got another gentleman up here,
That's it.
Russell, go ahead. You're up. If you want to unmute,
Yes, yes,
tell us your
yes.
experiences. Go ahead.
Well, actually, the experience I want to share, it's not, do you guys hear me okay?
Yes,
Yep, coming through
All
loud
right.
and clear.
Yeah, the experience is not mine. It's somebody that I shared the micro daily to. This gentleman, from what I've heard, I believe he was in the army and something like that, and he had some trauma and stuff like that, and then all of a sudden he started having those seizures, and actually would have multiple seizures every day. And actually, the day that I was actually doing his registration to engage in order to order the products, while I was talking to him, and then the phone went blank. I thought he just cut it off, tried to call him back and things like that, and he wouldn't pick up. Actually, he just had a seizure. And a couple of maybe 30 minutes later, we went back on the phone and stuff like that. So I introduced him to the Q4, and I said to him to try it for 3 months because he was looking for a solution. And he received the products 2 weeks later. Actually, next week is going to be a full month. But 2 weeks later, I had was on the call with him, and he was just not believing what was happening, because one of the first things he told me was every day the amount of seizures he used to have has dropped dramatically. And he said the only thing that he didn't understand is like he couldn't sleep. He couldn't sleep because he had that boost of energy. And I told him that I believe that through time, his body was going to stabilize, and then he would be able to have his sleep back properly. But the good news is that the amount of seizures went down, and that's what we were hoping for. And actually, I'm hoping that with time and consistency on the product, that he could get back his normal life.
Yes, another thing I would suggest for a seizure, that he should take CBD. Is he
Okay.
taking CBD? Because
No,
CBD,
rather is not.
no, because CBD, FDA has approved CBD to be given to children with seizure, and it is
Oh,
safe, non-toxic. So in his condition, I would say he should take 2 capsules of CBD that we have, and 2 capsules in the evening.
perfect. I'm
And
gonna tell him that.
it will be 100 microgram. And if he does, he can go up to 200, 300 milligram. And
Oh,
because from that, in combination that he is taking, he should not have any seizure.
perfect. I wanted to ask you, Dr. Prasad. I was telling him that maybe the next order to add the brain boost, will that help?
Yeah, brain boost is always good. Yeah, of course.
Okay, so I'm gonna tell him for the brain boost and the
And
CBD
CBD,
for his next
CBD,
order.
yeah.
Perfect. But I wanted to share
Perfect.
that, and then I will keep you guys posted on his
Yeah,
improvement.
after say 2 months, you can
Yeah,
again inform us how he's doing.
perfect. Thank you very much. I wanted to share
Sure.
that.
That's so exciting. Less than a month. Less than a month. You've changed somebody's life, and Dr. Prasad was here to share how you could even tweak that a little bit more by adding CBD, and then your question about Brain Boost was awesome. Wow. Oh man, where has the last hour gone? It's we're down to just 7 minutes left, everybody. Who's gonna bring in the best testimony yet? I don't know, it'd be tough to beat Alfreda's and what Russell was just telling us, and we've had some amazing ones on here. Who's got our last one for the day?
Me.
Okay. Who's me?
I mean, Loren Noel.
All right, there we go. Yeah, can you turn your camera on?
I'll try. I'm not
I'll click that, and it should just give you a
sick.
post on your screen
Let me
that
see.
says start video.
I always have problems with my video. I don't know. I don't know. But let me make it real short. I'm sorry because I had my tablet on all day and it's going dark. So maybe I need charging. But this is a good one. Okay, I had my report from my doctor. I've been taking the micro daily and other products for my heart, for my eyes, and all different products. And I really believe in micro daily because my doctor's report is I am 83 years of age, and the doctor says my inside is as a 75-year-old. And he says my blood pressure is good, my kidney is good, my liver is good, my bone density is good. Everything is so good. I have not been taking any other medicine but the micro daily. So I credit it to the micro daily, and I am advising everybody to take the micro daily along with a little bit of exercise. And if you can walk and eat, do not eat fast food, and you'll be healthy. Hopefully, you'll be live to see 91 like Dr. Prasad. So that's all I have to say. Sorry you can't see my face, but nobody knows my age. I'm just saying it, and I'm glad I can show my face, but I don't look like 83. And the doctor says I look like 75 in my inside. So that's very good. So
That's
everybody
good.
keep taking the product. I'm sorry. Next time, Bernard, I'll show my face, hopefully. And Melvin is there to confirm that.
Oh, that's so exciting. Love to hear the smile in your voice. You know, that's That's got to be some exciting news. So we've got Elizabeth, your hands popped up here quick, and so did Melvin. So let's we got time here. Go ahead.
Oh, tomorrow I can show my face. I'm sorry, Bernard.
Okay, I just want to say something very quickly regarding kidney failure. The person that I introduced Microdaily to in Bronx, New York, called me the other day. She says she went back to her urologist. He says to her, this is not supposed to happen. This was not supposed to happen. He expected her to go fully to kidney failure and was actually preparing her for dialysis. But her kidneys are restored. She's no longer in kidney failure.
That's amazing.
Wow, Elizabeth, that is really amazing. And how long has she been on?
She's been on about a year,
Okay.
but it has progressively gotten better. She was below 45 to start with. Now she's up to like 50 or 60. And not only that, she has lupus also. And she used to have weeks that she could not get out of bed. None of that happens anymore. She's not having any downtime. So it's been working on other things other than the kidney disease.
Great.
That is super exciting. Thank you for sharing with us. Wow. One more. Melvin Morris. Melvin, go ahead.
Yes, I am 76 years old. And I'm gonna make this real quick because we're running out of time here. I moved from New Jersey to Baltimore, Maryland. And you know you have to get a new doctor when you move. I went to the doctor in September and I told the doctor, take all my vitals before you start talking because I'm very hyper. Well, when they took my vitals, my heartbeat wasn't what they wanted it. Blood pressure wasn't what they wanted it. I went back October the 22nd. The doctor gave me 5 high fives. She said, for a person that's 76 years old, you are in excellent health. And I told her about the microdaily. She pulled it up. She said, when you come back, we're going to have to talk about this. I tell everyone that's on today, take the Core 4. You will not regret it. Me and Bernard talk every week, and Bernard can tell you that I'm an amazing individual. Before Microdaily, I have never taken doctor's medicine, and I hope I never do. I am taking the best doctor's medicine that's been produced, and that is Microdaily Core 4. And when the doctor gave me the high five, I took the doctor out in the office. I slid across the floor like James Brown. She said, I don't believe this. I said, you ain't seen nothing yet. So when I go back, we gonna really have a good time.
That's so exciting. Hey, Bernard, I'm going to give you the last word there. Go ahead.
You know what, people, first of all, I just want to thank everybody for sharing. In this case, sharing is caring, but you know what? I would love to have the last word, but I think the last word should be given by that man that got the biggest smile on his face I've ever seen. Dr. Prasad, what would you like to tell everybody about getting the word out about your products? I'm going to give it to you.
Yeah, but I mean, the simple like Core 4, the last gentleman mentioned, Core 4 is the central issue for your good health while you are aging, reduce the risk of chronic illness. And then as the need goes along, if you have currently have a heart issue, then you take Heart Boost. If you have a little bit brain issue, you take extra little bit Brain Boost. If you have a sleeping problem, you take a Sleep Boost that we have. And if you have like some kind of a hyperactivity, then you take CBD. So it depends upon after that. But Core 4 is the central issue. And as you know, I have mentioned to you that in this year, 6 international meetings that I was invited, I discussed the core importance of core 4 in prevention and improved treatment of Alzheimer's disease, Parkinson's disease, PTSD, and diabetes. And so it has been, and they all appreciated that very much so. And so I think this is my last comment.
All right, Jeff, could you go ahead and close it out with the offers? Well, the offers for the month to make sure everybody understand what the offers are. There will be no meeting for Jonathan's crew tonight. Jeff, go ahead and let's go ahead and close this out.
You bet. I haven't pulled the pictures over. For those of you that have been following through that app, you realize that between now and December 1st, we all have the ability to have a better night's sleep because it's a buy two, get one free on the Sleep Boost. We are also taking care of the men's and the women's hormonal issues. And I'm telling you, we just heard another report where a gentleman started the T-Boost and his wife says, I'm going to be down for getting that she wants 3 more bottles and she's ordering it for him. That's how exciting it is. And so just like the men are benefiting from it, we have ladies from young to old that are also really just shouting the praises for the women's menopause relief, but it's way more than just menopause. We have young ladies that have had very difficult cycles that are now just breezing through it. And just like Alfreda was talking about here on her testimony earlier, that women's menopausal relief formula is very, very beneficial about preserving bone density. And Dr. Prasad has talked about that. And I know that's why my sweetheart Helen is taking that, as well as providing assistance when it comes to the brain. So preserving those memories is also a very, very beneficial benefit of the women's menopausal relief. So thank you everybody for being here, for being a part of our story hour. It's exciting times. Happy Thanksgiving to everybody on Thursday. Be well, be with your families. Love and blessings to all.